Hi there, I'm Allie from An Essential, your friendly OR companion.
In this short video, we explore the latest 2024 clinical practice guideline from the European Society of Intensive Care Medicine on fluid therapy in adult critically ill patients, focusing on the choice between albumin and crystalloids, as well as the key recommendations. The guideline makes it clear that for most critically ill patients, crystalloids remain the first-line resuscitation fluid. The guideline reviewed multiple randomized controlled trials comparing albumin with crystalloids for fluid resuscitation in critically ill patients. The overarching conclusion is that albumin does not offer consistent clinical benefits over crystalloids in most general ICU populations. In general critically ill patients, the SAFE study 2004 found no significant difference in 28-day mortality between albumin and saline. Subsequent meta-analyses confirmed that albumin is not superior in reducing mortality across broad ICU populations. In sepsis, while earlier studies hinted at a possible mortality benefit with albumin, especially in septic shock, the evidence remains low certainty and not robust enough to support a strong recommendation. Thus, crystalloids remain the first-line fluid. In patients with liver cirrhosis and spontaneous bacterial peritonitis, albumin is favored due to strong evidence showing improved outcomes such as reduced renal dysfunction and mortality. Hence, this subgroup is the key exception where albumin is recommended over crystalloids. The panel also highlighted cost and availability as important factors. Albumin is more expensive and not widely accessible in all settings, which limits its utility outside of very specific indications. When it comes to choosing between balanced crystalloids and isotonic saline, the guideline offers several conditional recommendations based on available evidence. Table 2 presents conditional recommendations for the use of balanced crystalloids versus isotonic saline, organized by patient subgroups with an assessment of the certainty of the underlying evidence. 1. In all critically ill adult patients, the guideline suggests using balanced crystalloids over isotonic saline. The rationale is that balanced fluids, e.g. lactated ringers, plasma light, have a composition closer to plasma with lower chloride content, which may reduce the risk of hyperchloremic metabolic acidosis. Several trials, e.g. SMART trial, SALT-EAD, suggest that balanced fluids may reduce the incidence of acute kidney injury, AKI, and the need for renal replacement therapy. Although the mortality benefit is not definitive, the certainty of evidence is rated as low, so this is a conditional recommendation. 2. In patients with sepsis, balanced crystalloids are again preferred. This recommendation is supported by subgroup analyses of large trials, e.g. SMART, which indicate a potential benefit in reducing renal dysfunction. Given the pathophysiology of sepsis, where fluid balance and kidney perfusion are critical, using a fluid that reduces chloride burden may be advantageous. However, the evidence is still rated low certainty. 3. In traumatic brain injury, TBI, the guideline suggests using isotonic saline instead of balanced crystalloids. This is due to concerns that some balanced fluids have a slightly hypotonic profile due to substances like lactate or acetate, which may increase the risk of cerebral edema. Since TBI patients are vulnerable to increased intracranial pressure, avoiding hypotonic fluids is critical. The certainty of evidence is very low, yet the panel issued a conditional recommendation favoring saline due to theoretical safety concerns. 4. In patients with acute kidney injury, AKI, the use of balanced crystalloids is also suggested. Although the evidence is of very low certainty, the rationale is based on potential renal protective effects observed in previous trials. High chloride levels from saline can lead to renal vasoconstriction and impaired kidney function, thus supporting the use of more physiologic balanced solutions. It's important to note that these recommendations are conditional and based on low to very low certainty of evidence, which means clinical judgment and individual patient context remain essential. In summary, use balanced crystalloids for most ICU patients, especially those with sepsis or AKI. Use normal saline cautiously in patients with brain injury, and reserve albumin for specific indications like cirrhosis. These recommendations are designed to support safer, more effective fluid resuscitation in critical care settings, tailored to the needs of each patient.